If mom and baby are doing okay, is to stay pregnant as long as possible to mature your baby. But we have to keep both of you and the baby healthy. So whenever they say it's time, okay? Steroids are great. You're getting those for lung maturity right now, but they do not make full-term lungs, okay? Magnesium is good because it stops labor and it brings your blood pressure down out of stroke range because we don't like strokes. But it does make babies really sleepy and makes them have pauses in the breathing. So that's one of the things we watch too, okay? So you're doing whatever they tell you to do, and your baby and your body will tell us when we have to deliver. Hopefully not for a long time, okay? Everything else going okay with your pregnancy?
Yeah, so far.
Except today?
Except for today, yeah. It was the first time. I was telling them, well, when I first called the on-call doctor, she was asking me what happened. I'm like, oh, I just wanted to go pee and there was blood and I've never had blood before. And then we came here.
Well, it was good that you did.
Yeah.
So did they answer all of your questions? Did everybody just, kind of explained everything that's going on right now for you?
Yeah, in terms of what's going on inside the baby and all of that, yeah.
So that there is bleeding now, but it doesn't look like it has continued, and hopefully that stops. And the baby's heart rate looks good. But right now you're contracting some, but you don't feel them, so hopefully not dilating, which we don't check frequently because the more times you check, the more chance of rupture, okay? Plus it introduces bacteria, so we don't want that.
I think the last time that the first and only time the doctor checked, it was 0.
Right,
like,
so that's
no
good.
Dilation. Yeah.
So if you were feeling painful contractions, then we would probably check you again, but we don't, like I said, we don't want to do that because that could cause problems. And then blood pressure. So magnesium builds up, so hopefully that will fix that. It's going to be one of those things where you just kind of have to keep track of it and just do what they tell you. Unfortunately, that means a lot of bed rest for you right now, probably. So we'll see what happens. A lot of times when we come talk to people, we like to tell them how a delivery for a preterm baby would go. So like if we had to deliver today, what that would look like. And then admission to the NICU, kind of stuff like that, okay? Is that okay with you?
Yeah.
Okay. I hopefully won't drive your blood pressure up higher just talking about it, but sometimes that happens.
They increased my blood pressure medication, so I think we're good.
Sometimes it happens. Yeah. All right, so if we had to go back emergently, we would probably be doing that by C-section, okay? Because if there was a bleeding issue and your bleeding picked up, baby's heart rate had a problem, you want to do that fairly quickly, okay? So I'm not telling you you have to have a C-section, I'm just saying if it was an emergency, we probably would do that, okay? Is your baby head down or head up, or what position is the baby in?
I think it was head down.
Head down.
Okay.
Yeah.
So if you were laboring and the heart rate was okay, they may let you vaginal deliver. It just depends, okay? But if it was a heart rate emergency or a bleeding emergency, we would go back for a C-section, okay? When you go back for that, they take you back first and make sure that they get you nice and numb, and they call us and say, hey, come get the room ready. And when we do that, we come down and we turn the heat in the room up. And I'm sorry for that because magnesium makes you sweat. It does. Y'all are gonna freeze because she's gonna be hot. But the babies are small, so we have to turn the heat up and we will all be sweating. Okay, so we apologize for that. But it's good for your baby. So we turn the heat up, we turn the oxygen on, the suction, the monitors, and all the stuff, and we bring a bunch of people with us. Okay, so for preterm babies, there is a nurse on the delivery team. That's me today. There's a respiratory therapist. There's a provider, so a nurse practitioner or doctor, and a nurse to catch the baby. So there's a whole bunch of people just in the corner, just for the baby. Okay. When they get you ready to do your surgery, they call Dad in, and he'll be in there hopefully, unless it's a really fast emergency. Sometimes we don't have time to do that if it's like has to be really fast. But when they get preterm babies out, we don't hold up for lots of pictures, okay? Because the goal is to kind of clamp the cord and then take over so we can stay nice and warm and clear the airway and make sure we can breathe, okay? So the first thing we're gonna do is dry the baby off, suction any fluid out that's in the mouth, and then make sure the baby's breathing okay. We hook an oxygen monitor up to the wrist up here, and we just kind of see how that goes. Most oftentimes at 31 weeks, they're going to need a little bit of help. We put a mask on their face that does what we call CPAP. That's basic pressure, so the baby's taking breaths, but it doesn't exhale all the way down for the lungs to collapse. So if you know anybody that's got a mask for sleep apnea that wears that at night, it's the same kind of device. It's just they're taking breaths but not then oxygen. A lot of times if we have to do something for an emergency, a lot of times they come out and they may not take deep breaths. So we may have to put a breathing tube in to do breaths for the baby, but we'll see how it goes, okay? We kind of clean everything up and then put bracelets and do footprints, and then we'll call Dad over to the bed and say, this is what's going on, this is what we see, and we'll kind of see how it goes. It looks like your baby is a decent size for 31 weeks, but they're still premature with their temperature control, so most of the time we'll wrap the babies up and put them in the incubator and then bring them over for you to see. So if we wrap a tiny baby up and put them in the incubator, you got a hat on and blankets on, so most of the time you see like this much of their face, okay?
Yeah.
So you're supposed to take a lot of pictures. So that means from here on out, your phone has to be charged and you have to clear some space so it's not totally full, okay? You can have it, but that doesn't mean it's charged.
Yeah, that's fair, that's
but
fair.
you're on call all the time for this now, okay? So he's the one who has to do that. Now, I'm not promising with what kind of good drugs you've had, whether you will remember every bit of it. That's why I'm also telling him to take pictures, okay? Because it's important to not feel a C-section.
Yes.
So that's the most important part, okay? So even if you're talking to me, you may not remember all of that, so that the pictures are important. But we have very rarely been working on a baby longer than they've been working on a mom. So very rarely do I not get to bring them up and at least let you go, here, look, here's a little tiny face, and let you see this much, okay? But we'll do our best. If you had gotten closer to 34 weeks, we could probably wrap in a blanket and let you give a kiss, but at this gestation, it's too small.
Right.
Okay, so we'll just see how that goes.
In terms of cutting the cord, because
In a sterile procedure in an operating room, you can't, but if we were closer to term or a vaginal delivery, it might be a little bit different.
I figured, and that's why I asked, because, you know, I figured that's off the table for, you know.
It just depends. When they get closer to 34, 35 weeks, it's not as big of a deal because they're screaming and crying. If we're on a lot of magnesium or if we're doing an emergency thing, we don't tend to worry about that.
Yeah.
We just let you do other things.
Yeah.
But if we're 31 weeks and in an operating room, probably not. Okay, because what we do in those cases is we try to make sure there's not bleeding from the baby. Okay, so we clamp the cord as soon as we can, and then what we like to do in the NICU is, if we can, we clamp the placenta and we try to do any admission lab work that the baby has off the placenta, so that I can go ahead and draw labs and not have to poke your baby. Okay, so there's other things that go into it with preterm babies, but get you involved. You'll be doing stuff,
Yeah,
okay?
awesome.
So, it might not be the cord, but you'll be doing some fun stuff, okay? And like I said, it sounds like it's not a fun job taking pictures, but that's the most important part that day, because she doesn't get to do as much participation as she wanted to, okay? So, when we come over and see you, then we're going to go up to the NICU. The NICU is on the 5th floor. So right now we're on the 3rd floor. In between is mother-baby postpartum. That's the 4th floor. And we're up on 5. And we get half of the floor because our babies are small, so they have small rooms. So we only get half of that floor. We have 28 rooms up there right now. I've got like 18 babies or something today. So we usually have decent space. The rooms upstairs are private rooms for the babies. So if you can imagine, since we have smaller patients, they're not this big. They didn't give us this much room. It's about 2/3 of the size of this room. And since the babies don't use them, there's no TVs and there's no bathroom because the babies don't need that. So we have a little fridge in there for breast milk, and we have a little chair, and we have a big fancy incubator bed that does all kinds of space age things. And the top goes up, and it has a scale in it usually, and it's got monitors and all this kind of stuff. So there's a lot of equipment there, but it's not as scary as it sounds, okay? Mostly it's just to put your baby on the bed, to lower the top and have it warm and quiet and windy draft free, so the baby has a place where it's quiet and calm to sleep and grow, okay? And then the monitors are there for your heart rate and your breathing rate and your oxygen and stuff, and in our unit they're on the monitor till they go home, okay? Most oftentimes babies in the unit will need IVs. IVs are kind of like yours. They're in the hand, the foot, the top of the head, the belly button, wherever it takes to get them. And they give sugar and nutrition and any medicines that the baby would need, okay? And we start off with IV fluids because at 31 weeks, babies aren't mature enough to suck and then swallow and then breathe again, okay? Sucking is usually down. They can suck their thumbs or their fingers and they can do that, but the swallow part chokes them up, and then they don't always take a breath again. So they have a problem with that. So we start that around 32, 33 weeks, just depending on how their breathing's going, and then we move up from there. But we do like to introduce food when we can, but we'll do the IV fluids first, and then the food would go through a feeding tube. Feeding tubes are in the nose or the mouth that go all the way to the stomach, and that way we can put it in without stressing them out having to eat. Okay? Are you gonna breastfeed or bottle feed?
Bottle feed.
Okay. We would ask you to pump breast milk if you can. If you don't want to do that, you can let the doctors know, and there is a availability of donor breast milk. The earlier your baby is, the more chance they need that, because they're not able to digest formula very well, but they'll talk to you about that, okay? But there are other options. If you don't ever want to breastfeed, if you just want to pump and give milk, that's okay too, okay? So, up to you. Let's see. Talked about feeding tubes, you talked about IV fluids, and your really breathing support is going to be based on what your baby needs. So your baby could come out screaming bloody murder and be nice and pink and not need any breathing support. At 31 weeks, that's pretty rare. Usually they need at least a little bit of something, okay? So when we do that mask in the delivery room, a lot of times we put a little cannula in their nose, and it can provide that CPAP for them, and we call it bubble CPAP, and they keep that for a little bit, and then we wean it off, okay? If the baby comes out and doesn't want to take any breaths at all, like I said, we would do a breathing tube for that, and that would be a ventilator that does breaths for the baby. So ventilators aren't very common, but it just depends on the delivery situation on how that happens, okay? So when your baby comes out, we would be treating your baby as a preterm baby, not necessarily a sick baby, but sometimes they can get sick being here. So if you are ruptured for a long time, if you rupture when you're here and you get an infection, or if the baby comes out and gets exposed to something and then gets sick, then what we do is we treat that, and then they kind of take a step back and then they kind of move forward. So we work on treating that. But the goal is to get your baby mature enough to go home. A lot of the things we worry about are the baby's weight, because all babies lose weight at first. So your baby could be 3.5 pounds at birth, and then come out, and then the next several days lose weight every day, and then be closer to 3 pounds in no time. So the things that we do in there work to minimize the weight loss, and then getting your baby gaining weight. So IV fluids for sugar and nutrition. The incubator bed does the heat, which means they're not burning as many calories to stay warm. And then we do call it kind of a minimal stress or a clustered care, where we do all of their care time on a schedule. So we're keeping them asleep as much as they can, and they save their calories and try to get bigger that way too, okay? So our schedules are every 3 hours. I don't know what schedule it would be. They tell us up in the NICU what schedule it is, but it's every 3 hours, like a 9, 12, 3, 6, something like that. And that would be when we do temperature, diaper, and then when we're ready, we do holding and feeding. It's 8 times a day. You're more than welcome to come in and do all of it if you want to, but you don't have to. So whenever you want to participate, you come and do that. Can you come in between times? Yes. But we won't be waking the baby up or trying to get into the bed until it's care time, okay? So that's how we kind of save that for the sleep time so that they can grow, okay? What else? The goal is to get your baby digesting food. So we introduce the food slowly and work that up as we can so that we can get rid of the IV, okay? So as your food goes up, your IV rate goes down, and hopefully we get rid of that, because we have to poke you to put an IV in, and we don't want to keep that unless we have to. After that, the goal would be to learn how to eat by mouth. So the baby's trying to eat by bottle. Sometimes they do great, sometimes they do not. So we'll just kind of have to see how it goes. A lot of times they'll eat once a day at first, and then they'll do twice a day, and then they'll kind of work up from there. And then a lot of times that's the thing that's keeping them in the unit. When they get bigger and they're in a crib and they're keeping their temperature up and they're doing really good, sometimes they just don't like to eat all of their food. So that's the goal to work towards. What else? Any questions yet?
No, you're doing a good job.
You do. You got questions. I'm not done yet.
Yeah.
No?
Yeah,
Not yet?
no,
Okay.
no.
So,
Good.
everybody's favorite question is, when is your baby going to get to go home if it's born at this gestation? When is your due date? Okay, so you tell everybody April 3rd. Does your baby have to stay here till April? No. Can it stay here till April? Maybe. Okay. So the goals for us would be gaining weight, maintaining your body temperature in an open crib, so no extra heat, okay? Eating all of their food by mouth 8 times a day, and not having any drops in their heart rate on the monitor. A lot of times with that, it's called apnea and bradycardia. That's the fancy words for that. But pretty much means a preemie baby gets really sleepy, doesn't take deep breaths because it's really tired. That's called apnea. And then if it doesn't take lots of breaths, then the heart rate drops. That's called bradycardia. And they can't go home doing that. Something that preterm babies can do, but they usually grow out of that by the time they're term. And we don't know when they grow out of that. They tell us. So if your baby is doing great and eating all of its food and in a crib and ready to go, but it drops its heart rate on the monitor, it's got to stay for a little bit longer, just till it's more mature, because you definitely don't want them doing it at your house when you don't have a monitor. Okay, so those are the kind of things that we're looking for. We will need a car seat that goes down to 4 pounds before your baby goes home, because we stick them in the car seat and do a breathing test for an hour on the monitor to make sure that they do okay in that, but not anytime soon. We're not worried about it right now. And is this a boy or a girl?
It's a boy.
Boy, okay. Is he having a circumcision?
Yes.
Yes, that won't be anytime soon. He'll be closer to going home when the baby's much bigger, so we won't have to worry about that right now. We do make an appointment with the pediatrician for you. The earlier they deliver, sometimes we had to do things like head ultrasounds just to check for if there's any bleeding in the brain or brain growth and development. We do sometimes do eye exams if they're on oxygen for a prolonged period, just to make sure that the vessels in their eyes are doing okay. Sometimes we do physical therapy appointments for them just to make sure that their muscles are developing and everything tone-wise is good. Just lots of different things. The closer you get to full term, the less of that stuff you have to have. Okay? That's a lot of stuff. No questions yet?
So when I talked to my doctor, she said we'll try to aim for 34 weeks.
Okay, so that is a very good goal.
Yeah.
If you deliver at 34, you still have to come to the NICU.
Okay.
Okay, but it wouldn't be for nearly as long.
Yeah, that's what she was saying.
Yeah.
And during that time, I'll be in the hospital until basically I give birth, is what she told me.
Most of the time, not all the time. It would just depend on what they discovered in your ultrasounds and how your blood pressure is managed.
Okay. Yeah, that was going to be my question, is like, if we make it to 34 weeks and then if we continue making it
You can
further.
always ask.
Okay.
I'm not in charge of that.
Okay. You're not sure. Yeah, I just didn't know what, like,
But
You've
remember in the
seen-
back of your mind, 40 weeks is full term.
right?
Babies don't know math. You can try your hardest to get to 35 and your babies still come to the NICU. Because we take all of the babies that need help, okay? So I have 38, 37 weekers all the time. So it just depends on how it was meant to be. And you're doing the best that you can by doing what they tell you to do. That's all you can do.
Yeah.
Okay? So you're growing her bigger, you're growing him bigger, you're growing him more mature. That's the goal. But will he necessarily, if you get a little bit further, not come see me? Not necessarily.
Okay.
So just don't panic about that number.
Gotcha.
Because you're doing the best you can right now. Okay. So visitation is another big question for people. Right now in our unit, since it's flu and COVID season, RSV is very big for us. We are no kids under 18. So not even siblings can come in right now. It's 3 people at a time can visit. Nobody that's been sick or been around anybody that's been sick. If you get sick, you can't come visit. So make sure nobody comes to see you that's been ill. There is a lot of flu and COVID going around this city right now. So be very careful. Make sure that nobody comes in unless that they're okay to see you, because a lot of people are getting really sick. Okay. Everybody washes their hands every time they come visit. The parents can do 24 hours. Other visitors, it's like 8 a.m. to 7 p.m. and then from 8 p.m. to like 11 p.m. So it's kind of however you want to do it. You don't have to tell everybody that they can come in. So that's up to you. If you don't want anybody to come visit, you can say, nope, they said no visitors, and we'll back you up. Okay? Because really we can only give information to you and Dad anyway, so they won't know. Okay?
We don't want visitors while the baby's in the NICU.
It's totally up to you. You tell them the doctor said no. Sorry, nobody can visit. That's okay. All right. We do save all of the care for the parents because we want you to know how to take care of your baby. So like I said, you're more than welcome to come in whenever it's care time, and we will let you do as much as we can. A lot of times the first way that you're holding your baby is kangaroo care. Have you heard of that before? It's skin to skin on your chest to where you can just put the baby here and do that where your body temperature is keeping the baby warm. A lot of times when babies are really small or not feeling very well, that's the only way that we'll hold them because the in and out of the bed part is stressful, okay? So a lot of times that is a scheduled thing, and we want you to have gone to the bathroom and had your food and your medicine and all your stuff to where you can come and sit for like an hour or an hour and a half and just kind of just be calm, okay? So we'll let you know. And then if your baby gets older, then we'll have you doing more feeding the baby. So that'll be more of a frequent thing. Okay. Where do you live?
Georgetown.
So not far, but kind of far when it comes to that. We do have a fancy pull-out cot that you can lay on and stay with the baby if you want to. But like I said, there's no bathroom or anything in there. You can't eat in the room. So really there's a parent lounge at the end that has a fridge and a microwave and stuff. And a bathroom next to the lounge that has a shower. So if you feel like you can't leave, you're more than welcome. But you don't have to. Okay? You're more than welcome to set a kind of schedule for your family. And you all decide when you want to come up and visit. And it's fine if it's once a day or every other day or once a week. I don't care. But if it's a week and I haven't heard from you at all, we may be calling you. Okay? You'd be surprised that happens. So, yeah. So it's kind of play it by ear because life goes on. And if you're in our unit at 31 weeks, that's a lot of weeks left to go. Okay? And that's a lot of time that you have to account for. Some of it you can't drive. So you'd have to have people driving you back and forth. Lexington traffic is really fun.
Yeah,
we had a fun morning getting
These
here.
parking garages during the middle of the day are terrible. Okay, so beware.
That's true.
But you know, we are very regimented in our schedule of care time. But if you come in and you're like, okay, then just stay for the next one. It's okay. So just kind of call and check on the baby whenever you want to, and just let us know. We do have a camera. We just got new ones that you can sign a contract, and we can kind of aim it at your baby. And there's a little thing where you can do it on your phone. They're nice. They're kind of fun to just kind of log in, and you can see your baby when you want to. But if you happen to have high anxiety, and if you logged in and your baby's sleeping on the pressure, or they're pulling on their cannula, or they spit up a little bit, and that really bothers you, don't use a camera. Because sometimes that drives people crazy, and babies do that. And if they're asleep on their passy, but they're asleep and they're fine, we're not going to wake them up to move it, okay? Because sometimes you kind of have to learn a little bit of don't wake a sleeping baby if it's doing okay. So kind of think about it. If you want to, that's great. There are people that like to give other people access to that. You were the only one that could call me and check on the baby. So if other people in your family get access to the camera and they have high anxiety, that means they're calling you. So I would give that out judiciously if you would like to do that. Other than that, that's pretty much all I know. That's a lot of stuff.
So in terms of her recovery, you know, if we have the baby early, so what you're saying is like we may be good to leave.
You will definitely go home before the baby, for sure.
Okay.
Yes, but it would depend on how you deliver and what your medical status is after that on how long you are here. But like I said, 31-week baby could be here for weeks, okay? So that's why I say you would be going home before the baby. But if you deliver at 35 weeks, I don't know, and maybe your baby could stay in your room. It just depends. But I would plan on a NICU stay and plan on just taking it day by day when you deliver. Because if you have a vaginal delivery that goes uneventfully, that's great. It's a much shorter stay for you, okay? If it is a C-section that was an emergency with bleeding and blood pressure problems, you could be here for almost a week. Now that's not a good thing. It sounds nice, but it's not, because that means you didn't feel good and you have lots of issues, okay? So we don't want to wish that on anybody, but just day by day. So right now your goal is to stay pregnant.
Yep.
And get your blood pressure down.
Girl, that was my goal the whole time. That's why we told the baby.
We're breaking it down in little baby steps here. That's what our goal is today, okay? and then kind of talk about whether you want to pump or do donor milk, and you can think about that. And then when you have to deliver, your goal that day is to have a good delivery and your baby come out okay. That's it, okay? And then after that, it's baby steps on how you're going to recover, okay? And they'll tell you all the things for you, because I know some stuff, but I don't know what your doctor's going to say, so I don't go into that, okay? Because I don't do big people. But baby-wise, we can tell you every day on how we're looking. But it's easy for us because they all kind of go in a kind of a linear kind of format, you know, unless they get sick or they have abnormalities, it's all kind of basically the same. Is it at the same time for everybody? No, because everybody matures at a different rate. So I can't tell you your baby will eat for sure at 32 weeks by mouth, or come off its oxygen at 34 weeks, or get into a crib at 35 weeks. I don't know, because we'll see. But it's kind of still all in the kind of same order of things. Okay, so that's kind of why we like it, because it's mostly predictable. Okay, you're gonna be here for a while, so you have plenty of time to think of a million other questions. Write them down on your phone, okay? And then they can call us back and we can talk to you again, or we can just answer them at the delivery, however you want. Okay? But phone charger.
Yeah,
Make sure that you eat when you can eat, because when they tell you that you can't eat in front of her.
Yeah.
That's mean. Okay?
Obviously. Yeah.
And when it's time to deliver, you won't get to eat for a little bit. So that's why I'm saying that. And we don't like you to go back to a C-section if you haven't had food, because then dads tend to pass out.
I also
Do
don't
big
like blood,
people.
so.
Then he will pass out.
I'll be all right.
Well, there's a drape. There's a drape.
I'll be
And
all
you
right.
don't have to look over the drape.
But you know, I'll make sure to eat.
Oh, you're tough.
Yeah, I'll be all right.
You're so tough.
And if you get really hot, you can sit down.
Well, yeah, not like anything's happening to me. I think I'll be better.
Sometimes it's almost worse when it's your family. Because we
Yeah.
told somebody that the other day. They're like, oh no, I'm good with all that. I've seen stuff. I'm like, it's not the same
Yeah.
when it's your wife and your child.
If given the option, though, obviously I want to be there for her. So hopefully
Yeah.
I'll be
So,
strong for her.
like I said, unless it was a really fast emergency,
Yeah.
sometimes they have to put people to sleep for that.
Yeah.
And that would be the only option that I would see that he wouldn't get to be in there. Okay. And or if you've gone home, because you know weird things happen when you tend to go home, and we have to do it before you get here.
Yeah.
But that's just to be life saving, and that's important. All right, I'm gonna go see what else I can get into. If y'all think of anything else, let us know. Okay.
Hey, thank you very much.
You're
I appreciate
welcome.
your-
Thank you.
No problem.
And what was your name again?
Tracy,
Tracy.
you'll see me plenty.
All right. Thank you so much.
You're welcome.